So the changes that occur in a face and neck lift really take 6 months or more to see definitively. I like to give patients a sort of analytical answer to this question, but basically a lot of the swelling and bruising and everything is going to happen in the first week or two, and then will go away pretty quickly. But there's a longer process that's taking place where incisions are sort of firming up and becoming more sort of normal texture and color matched to the surrounding skin. Little pockets of swelling may persist for a few weeks to a few months after that. Some of the sensation in the face will be returning. And so these things take longer. Really, 6 months is a reasonable measure, but sometimes even longer than that, depending on the patient and exactly what type of surgery was done. For many patients, the wow factor really happens when we take their postoperative pictures. An interesting phenomenon that we all experience is when you look at yourself every day, you may not see the subtle changes that are sort of accumulating over a period of a few weeks to a few months. And for this reason, I often will print patients before and after photos and give them a copy around the 6-month follow-up visit. That's probably the time where we see the most wows. When we first take the bandages off after a face and neck lift, most patients are surprised by, number one, the generally lack of bruising, and two, typically the definition that they see in their lower face and jawline. There's obviously going to be swelling after the surgery. Typically we'll see some bruising even a few days later, not immediately after the surgery, but most patients are generally really surprised by how good they look right away. And particularly when patients bring a partner or a loved one, that person is often very surprised as well. And it's fun to see the patient see that in their partner's face when I take the bandages off.